Does everyone who has surgery regain the weight?
Of course not. Around 70% of patients keep their weight loss situation in a long term with the proper follow-up, nutrition, and lifestyle changes. But of course, the others, if they couldn't access these changes, they regain partial weight of their weight loss.
Does surgery automatically fix all health problems?
Of course, not all health problems, but we can say that it depends on your health problems and it also depends on your surgery type. For example, you have a blood pressure disease and your father, mother, and all your family members have a blood pressure disease. I mean, it's not just related being obesity. Yes, obesity surgery will help you and reduce these symptoms or what you have, how many drugs have you used for the blood pressure disease. But of course, it will help your blood pressure conditions also getting well. But also, you have a genetic problem for this kind of disease that will be relapse after maybe 3 years or 4 years after surgery. It depends on your health problem and the obesity surgery.
Does chewing gum really harm your bariatric surgery results?
Actually, it's not happen like this. Chewing gum makes you, yes, I'm chewing something, and during these signals, your stomach, your all intestine and digestive system thinks that, yes, the food's coming in 5 minutes later, but it's not. That's why all these enzymes and other things will be secreted, but after that, after for example 10 minutes later, they will be stopped because the food is not coming. And also chewing gum, it's not strange or the get wider your stomach. It's not affect your physically or anatomically any changes, but the hormonal and the secretions are different. That's why we don't want to chewing gum.
Is it safe to drink alcohol after bariatric surgery?
Oh, that's a risky condition. Alcohol is a risky beverage because alcohol, yes, is easy to consumption, but it's empty calorie. I mean, it has a high calorie, but you couldn't, yes, I'm full, or yes, I'm not hungry when you drink. And also, it's risky. It depends also your surgery type, but most of them, when you drink alcohol, it's affect your body more than normal, and it's affect your body faster than normal. That's why we don't want to use, and most of surgeons don't prefer that minimum between 12 months after surgery, they don't allow to take alcohol. That's why also some patients, there's another risky for the alcohol. The patients change their addictions to the alcohol. That's also risky. That's why we don't want to, because it's easy to drink, it will give you good taste and good mood, but high calorie. That's why we don't want to use that alcohol.
Can air from soda or straws stretch your stomach?
Actually, it's not. But of course, when you take these gas beverage or the straw, you take the more air than normal, and it will be bother you, and you feel gas or cramp or stretch the abdominal wall. It will turn into pain, abdominal pain for you. That's why we are not allowed, or we are not advised to drink alcohol or these gas beverages.
What is dumping syndrome, and can it be prevented?
Of course, dumping syndrome is that when we take the food and according to also your surgery, but it will be seen most of after the bypass kind of surgery, because food will be pass your intestine system faster than normal, and also it's absorbed faster than normal. And all these, your nausea, your sweating, your dizzy mood will be cause of the insulin secretion. And of course, it will be prevent with you should arrange your diet, or you take these kind of food slowly than normal. Yes, you can handle it, but if you have too much problem about it, go to your doctor and see them.
Why some patients feel pain in the shoulders after the surgery.
Actually, this pain is not related about the surgery. It's related about laparoscopic surgery and the techniques. During this laparoscopic surgery, we use carbon dioxide gas to inflate the intra-abdominal area and reach and to see the organs. That's why when we put gas the abdominal area, gas elevate your diaphragm, and elevate diaphragm make a signal to your shoulder, and it turn into pain. This is the mechanism of this pain, and it can be happen after even if appendectomy surgery or gallbladder or any kind of laparoscopic surgery.
When can I start using a straw after surgery?
Actually, when your healing completed after surgery, you're gonna be learn how you eat or drink the foods properly. And also, after surgery, your diet, first liquid diet, then pure diet, then the solid diet. And after these, for between 6 weeks later, you're gonna be learn how you eat with your new diet. And after all that, yes, you can start the using straw slowly, and you can check your body how it responds. According to this, you can continue.
What is the difference between surgical gas and digestive gas?
Actually, surgical gas happens after surgery. It takes maximum 3 or 5 days after surgery. But the other one, intestine gas, can be happen after surgery. I mean, it depends on your stress level. It depends on most of what you eat or drink or how you drink. If you take the foods fastly, you take air more than normal. That's also turn into intestine gas. And if you have some medications, for example, some drugs also have effect to create gas than normal. That's also related the intestine gas.